I don't know who does that.
This is recorded through the Tim Garner, and it's online.
Everybody, welcome to the December 17th, 2020 All-Member Poverty and Homelessness Board. I'm Chris Mcallister and Chair, and just wanted to go over the agenda real quick and then ask for any adjustments. And then we will hop into the approval and acceptance of statement and revenue expenditures. So can we please scroll up on the agenda? So we will be going over some committee updates. We're going to go over the point in time count methodology and approve it. We will be getting some progress updates from Sarai Johnson, Laura Ashworth, and Catherine Ryan. We will be talking with Amanda about the ESG CV application overview, and then we'll have public comment. Is there anybody that would like to add or adjust these? Hearing none. Also wanted to point out that Noreen will be leaving exactly at 1 o'clock. So if there's anything that Noreen needs to see or would like to focus on, I'd like to have that shifted forward. So that said, maybe we do a quick, let's try and do it in under 5 minutes, introductions. Who you are, where you're from. Chris Mcallister, lived experience seat, chair of the RFP HMIS Evaluation Committee.
Pat Farr, Board of County Commissioners. I am a representative representing the Board of County Commissioners.
Harold, Chair.
Lucy Venice, Mayor of Eugene.
Sean Van Gordon, Springfield City Council.
Cheryl Balthrop, Eugene Mission.
Steve Manella.
Sean Murphy.
Oh, excuse me, Sean, go ahead.
Sean Murphy, Laurel Hill Center, representing behavioral health.
Steve Manella, Lane County Human Services.
Rick Kincaid, Community Health Centers.
John Radich, Oregon Department of Human Services.
Burrell, Program Manager, St. Vincent de Paul, Night Shelter Annex.
Deborah Daly, Education Representative.
Kirsten London, Shelter Stakeholder Chair.
Congrats. Okay. Anybody else before we go into our agenda?
Me, Ashley Espinoza with Lane Workforce Partnership.
Foster Martinez.
Take it we're doing the introductions.
Mm-hmm.
Julie Wiesman, Women's Space, the Victim Services Representative.
Excellent.
With Department of Veterans Affairs.
I'm not seeing any mics light up. This is last call. Thank you everybody for being here. I appreciate y'all taking time out of your day to be here on a Thursday afternoon. Can I please have people look over the minutes from the October 15th all members meeting and the additional material on revenue and expenditures, and if all are according and not needing correction, may I get a motion to approve?
Move to approve.
Is there a second?
I'll second.
So that was moved to approve by Rick Kincaid, second by Lucy Venice. And all four, please signify by saying aye or thumbs up.
Aye.
Aye.
Any opposed, please say nay. Hearing none, motion passes. Thank you. So welcome, everybody. We are going, okay, that's the minutes. Can we please hear from Kirsten London on the stakeholders committee update?
Yeah, so we just met earlier. Well, we had a focus group that met earlier this month, or a subcommittee to get a focus group up and running. We are spending time trying to identify one, through the use of a focus group by consumers, what are barriers to them accessing shelter. So that's one of the things that we have been working on. And the other one is we are working on getting a survey, and are going to ask outreach teams to go out in the community and ask the unhoused community what they would like to see, what they would access, what services, shelter services they would access if we were to implement them. So that's really the work that we've been doing over the course of the last month and a half.
Excellent. Thank you, Kirsten. And I'd just like to recognize that Kirsten was recently elected as chair of the Stakeholders Committee. And also League has a new chair. Howard Mitchell is now the chair of the Lived Experience Advisory Group for Unhoused Engagement. So we have more voices coming to the table and sharing experiences and helping us find paths as we navigate together. Healthcare Committee, do we have an update?
Thank you, Chris. The Healthcare Committee has, as many of you are aware, several subgroups that continue to meet on a regular basis that have representatives from the health systems and the direct care providers. We continue to problem solve and troubleshoot related to care in our sheltered environments. That work's been shepherded by Teresa Rourke, and continues to look at providing additional services and support for sheltered environments. Our care coordination and discharge planning group also continues to meet and is working on some collaborative agreements across organizations and particularly across the health sector around our goals and collaborative arrangement for delivering more comprehensive and seamless care to the unhoused population. So those groups continue to meet. We don't have any specific recommendations at this time for the board.
Thank you, Dr. Kincaid. Let's see here. Is anybody from the Youth Homeless Solutions work group? Hearing none, we will pass.
I attended that meeting, so I could do, or Deborah, did you want to do a quick update since Susan's not here? No. We just spent the time talking about pallet shelters, and if we could get some pallet shelters, specifically a COVID pallet shelter. So that's the focus of that group, at least in our meeting at the beginning of December.
Okay. Thank you, Kirsten. David, would you like to speak about what the Employment Committee is doing? Mr. Heverland? His mic lit up, but then it went back mute.
I'm back with you. It shows green.
Yes, sir.
So we met on the 3rd of December with many of our members absent due to being directly engaged in services related to employment. As you know, key members include folks from the Employment Department and the Lane Workforce Partnership. So there was a lot of competing obligations there towards the year end. The discussion focused on developing a work plan, reviewing a charter or establishing a charter and a vision for 2021. While we focused on this year on exploring supported employment opportunities, next year we'll focus on the expectations and skills needs of employers as the COVID environment. So that was the primary focus of the meeting.
Excellent. Thank you, sir. League will be reaching out after it gets adjusted to its new leadership, and there should be a a state of homelessness report coming early January, mid-January, I believe, from last discussion I had with Howard. Other than that, we have a lot of action and activity going, which is really exciting given how much is shut down due to COVID. So I thank everybody who's doing these committee work assignments and support work, and look forward to hearing what we do over the next year. So with that in mind, is there any questions for those who did do a committee update from the members of the board? Yes, Commissioner Farr.
Thank you, Chair. And I just want to congratulate Kirsten on taking over in full stride the Shelter Stakeholder Committee. The wasn't mentioned, but the membership of that committee expanded just recently. It's not been reflected yet on our website. I would expect that will be reflected soon on the website. So, Kirsten, welcome to leadership, and you've already done a good job with the first meeting that you chaired this past Monday. Thanks.
Thank you, Commissioner. Seeing no other requests to speak on this topic, I'd like to move on to item number 4, the point in time count methodology approval. Is Lisa or someone from staff here to speak?
Hi, everybody.
Lisa.
I will walk us through this new process. Let's see, can you see my screen there? Yeah. So we have this is a pretty, HUD did decide that they wanted us to complete our unsheltered count in January 2021. And while it feels kind of stressful during a COVID pandemic environment and coming out of fires and all the other things we've been dealing with, it does make sense to understand how pandemics and other disasters impact homelessness across the United States. So we're in it. We're going to go ahead and participate, but we did request to change our methodology. And it's an opportunity, actually, because we have wanted to shift to depending upon our HMIS data supplemented by street count surveys versus our traditional model, which is street count surveys supplemented with HMIS. So you're familiar, most of the board is familiar with the homeless by name list that we've been doing over the last year. So what I submitted for HUD's approval, and they did approve this, is that we use a modified homeless by name list logic to produce the majority of our unsheltered count. And then we'll supplement those numbers with pockets of surveys for folks who the providers and advocates believe may be missed in the HMIS, the management information tool we use that most of the providers use. The result will be a higher count, and but based on our research, it will be a more accurate count because we are not soliciting surveys during the day or from people on one night. We are using people who have already accessed services in that month and to provide those data. So it will also be less work for volunteers and staff to collect these data. Across the country, this is a trend. So I was connected with the Connecticut Balance of State Continuum of Care, who is also doing almost identical work. And they're at the same place as Lane County, where they have a really strong HMIS, and they're doing the same thing. And in the state of Oregon, several people have submitted to use their HMIS data and also have been approved. So I believe this is a trend. It is only approved for this year. It has not been approved for ongoing, but when my conversation with the HUD rep that approves this plan, he believes this will be the future for our unsheltered count. I would like to answer questions if anybody has any before you consider the change. And I'm not sure how much detail you want for me to go into on how I've constructed the logic for this count.
Chris? This is Steve Manella. I just wanted to make another comment, and I wanted to thank Lisa for her work on this. This process that we had to go through with headquarters in Washington, D.C. was not an easy process. And, you know, I believe that Lisa's approach to this helped educate the person who has approval authority in Washington, D.C. And as she said, it aligns with, you know, our best practice of using the by name list.
Excellent, sir. Well, I appreciate that. And I was really concerned because we've had kind of a slump in engagement last year with people participating in the survey directly. And so I was curious about how we do it with even more barriers such as COVID. So I appreciate both the advocacy and the workarounds that we're trying to do. And so is there anything, Lisa, that you feel like we want to maybe hold on to and request next year that we did differently this year?
I think we should, after we submit the survey this year and with those numbers, it would be great to have an opportunity to reflect on what that looks like with this board and kind of dive deep into what we discovered and see if we can make a proposal for ongoing years after we go through that process.
And have we played much with the data with Tableau to see what it looks like with the past years now that we've got the new software?
I haven't put that in Tableau. That is a great idea. I'll go ahead and put that out there so we can take a look at doing some comparisons and get some trends on our point in time. Just a reminder, however, that the point in time really is a point in time. It does not reflect the impact on the community services or on the people experiencing homelessness in our county. Our by name list does that. And so this is a subset of the by name list, kind of truncated down to appease HUD's interests in a point in time and to have something comparable with other communities that don't have such a robust by name list.
Thank you, Lisa. And
Lisa?
I would like to.
Excuse me, Chair. Lisa, do you want to mention some of the sites that we will probably work with nonprofit organizations to do a little bit of surveying work because they're not in HMIS?
Yeah, so I'll be reaching out specifically to James to help organize the street outreach workers to identify those pockets through January. So because they'll have the I guess boots on the ground experience with folks. Also reaching out to those providers who have not been consistently engaged, like community supported shelters, Whitebird, and the city of Eugene, who is newly engaged, but we want to make sure that we use their expertise and identifying any of those pockets.
Thank you, Lisa. Commissioner Farr.
Thank you. I want to in turn thank Lisa for the work that you put into this for all of these years. And something that you said really piqued my interest. You talked about how robust our homeless name by list is. And just touch base on that a little bit more. I do talk with other counties quite often, and indeed ours does seem to be more robust. Can you elaborate just a little bit on that? How robust are we? I mean, are we kind of state of the art leading the way, or do you feel that we still have a lot of work to do to perfect that list?
It's an ongoing quality improvement on our system. But Lane County, we have always been really fortunate that the providers have stepped up and participated to the fullest extent in our systems. We only have a few providers that are hesitant or just don't have the bandwidth to be able to participate at any time. But as far as our emergency shelter and our other housing programs, we've enjoyed 100% participation for almost 5 years now, which is wonderful. And we have over 200 projects that are actively engaged in our HMIS. And our numbers are around 38,000 people who live in Lane County have services that are tracked through HMIS in the last 12 months. So we do have a great engagement, and that's because the providers have been there for us.
Chair Mcallister, Lisa, one more question regarding the providers, and you talk about bandwidth and making it easier for providers to actually provide the information that helps us to maintain an up-to-date HMIS and name homeless by name list. Do you spend much work making sure that it is easier for providers to provide the lists without a great deal of overhead on their part?
Well, we do. We pay for the licenses and we provide the training, but the agency still needs to carve out time in the workflow for their staff to kind of be allowed and encouraged to enter data. But we're seeing, I mean, over and over, we see the importance of these data. We're using them for some big ticket items, big ticket on the impact to people experiencing homelessness and dollars. So they do matter. And I'm just really so appreciative of the providers and these organizations for making that happen. It would not happen without them.
Well, Chair Mcallister, Lisa, thank you very much for the work you've done. For years now, you've been my go-to person on so many questions that I ask of our Human Services Department. Thank you very much. Thank you, Chair Mcallister.
Thank you for those questions and this work. I would like to say, as the by name list was referenced, that we do know that people come in and access services more often as it gets colder, and you can see those trends start to rise in the fall and then start to like trickle down in the late spring, early summer. And so I feel like while we have our reservations or concerns about the efficacy and the layout sometimes of the point in time count, I really think that that point in time has value, and that it is something that it's really logical and people can really coalesce around. When it's cold, when it's wet, when it's dreary, when there's holidays that mean a lot to families and communities, it can drive people either in to get support or want to be around other people. And so I think all of this is needed and necessary and helps inform the human side of what we do. So thank you, Lisa, for helping track that with the data.
Chair, may I speak to this just briefly?
Yes, Ms. Balthrop.
Cheryl Balthrop here. And I do very much appreciate the robustness of our data, but I want to just chime in on Commissioner Farr's comments. And it is, this data entry is entered by the agencies, by the providers, which Lisa mentioned. And it does take a tremendous amount of time. And I think it's very important that we look for ways to streamline that.
Agreed. Thank you, Cheryl. Any other comments or questions regarding this methodology? Hearing and seeing none, we will need to have a vote. So can I please have someone make the motion in a second?
I make a motion to approve the PIT process.
Thank you, Noreen. Can we get a second?
This is Sean, and I'll second.
Thank you, Sean. Motion is second, moved and seconded. All in favor, please signify by thumbs up or saying aye.
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 Any opposed? Say no. Hearing none, motion carries. Thank you.
Thank you.
On the next item, let's have Sarai Johnson, Laura Ashworth, and Catherine Ryan on deck about progress. I like progress.
We like progress too. Thank you, Chair. I wonder if it's possible to allow me to share my screen. Maybe that's a Diana or Amanda ask. And if not, I'll live with it, but I do have a very cute little PowerPoint. Yay, there it is. Woohoo! Thanks. Da-da-da-da. All right, let's get this party started. Oh, yes. All right. So between Catherine and Laura and myself, we can give you an update on both the winter strategies and where we're at with implementing those at this time. And also we'll talk a little bit about how we've been able to move some of our larger system related goals forward with this work that we're doing over the winter. So we will do that. So I'm going to turn this over actually to Catherine and Laura, perhaps even Reagan, to talk a little bit about the winter updates and some of the specifics on that, since I'm not really running any part of that day to day right now, and they will be much more equipped to share what's happening on that front. So Catherine and friends.
There we go. Okay, hi everyone. I was just smiled because that first picture was a picture I took yesterday morning of the pallet shelters at the fairgrounds. Early in the morning on my run, it was very exciting to see them out there. The numbers that are up on this slide are some of the pieces that are starting to come together. Right now, we have the 45 motel room project that's happening. We have 10 beds through shelter care that have folks in them. Those are all going really well. The providers are feeling good about that we really do have some of the folks who are most vulnerable to COVID in our community in those spots, which is exactly what we were hoping for. Coming soon, we are going to add in 11 additional spaces for that same population. And then we are working on hopefully having some motel rooms available for families sort of for the duration of winter rather than just for cold nights. So that is in progress as well. Specific to the pallet shelters, we had a number of them that maybe a month and a half, went out to rural communities in Lane County. So we had 18 to Cottage Grove, 21 to Florence, 6 to Veneta, and 3 to Oak Ridge. And those are all supporting their winter cold weather shelter programs this season. And then this week, as we speak, the remainder of them are now at the fairgrounds. We have 10 that are going out across 2 sites for families, 6 that are going to be used for youth. 12 of them are going to the Mission to help support their ability to safely quarantine folks who have maybe been exposed to COVID, and then 25 that went to Highway 99 to the Dusk to Dawn site to expand capacity there as well. So that leaves us with 13 that are going to be at the fairgrounds still after tomorrow. We have 11 of those that have locations that were very, very close to getting nailed down. And so then that will leave us with 2 that after we get through all of that, we'll come back to and figure out sort of what we want to do with those. And then I will give, I can do sort of an overview of what's happening with the city sites. So of the 5 rest stops, one of them was an expansion of an existing microsite. And so that one was able to kind of get ramped up pretty quickly and is going now. There are sort of 2, 3 of the next ones that are on their way, that are getting close. And then the remainder 2 or 3 are very close behind that. So that represents those 75 beds there. And then there are going to be 3 of the microsites, so 6 spot sites that are also in progress. And the RFP for the services for all of those closes on January 4th. So we should have providers lined up after that are going to be doing the kind of case management and housing navigation services for all the folks who are staying in those. So lots going on. We know that we still have more to do and we're working on it. But that is where we're at for right now.
Well, thank you. Is there any, yes, Commissioner Park?
Thank you. That's a wonderful and up-to-date update that you just gave us, Catherine. And thank you, Sarai. The work on the pallet shelters is really robust. And, you know, I first saw them in Cottage Grove when they were setting up their small village in Cottage Grove, which is supported by a mobile shower and sanitation unit. Now, we've been asking the questions about mobile sanitation at this, and it's been occurring at a number of different levels. There are shower units that are available, as we know, 2-unit showers that are ADA compatible, or they actually lower to the ground. Have we done any work, to your knowledge, at this point yet, Catherine, on acquiring those portable shower units for Lane County?
I don't know of anything. I don't know if Laura or Sarai have any other. I do, and then I think, I don't know if Reagan wants to speak to what the city is maybe doing there.
I will state that I've passed along the plans and also the purchase order, basically, that Cottage Grove put in for their mobile unit. The cost, I believe, around $70,000. It's a 2-shower stall unit with 2 accompanying lavatories, toilets. And it's self-contained and just from time to time needs to be taken to a disposal site or hooked up into a disposal site. I'm really excited about them. They're inexpensive, that we can use them very nicely, and hopefully, ultimately, our small villages of whether it be pallet shelters or other mobile housing units are supported by mobile, usable showers and bathrooms. That's just my hope, my dream, and I will continue to ask for that, continue to push for that. Thanks.
And I'm just gonna just sort of echo that, because that's been a discussion that I've had for a couple of years with this PHB group. It just brings dignity to people's lives when they can take a shower and have access to clean water and showering facilities. And I mean, there's just so much good about it. And I think, yeah, if we can explore that. I know also colleagues of mine in Salem collaborated with a number of different organizations, and I think the county might have been one of the organizations, and they actually have a 3-unit mobile unit, shower unit, and I think it costs them around $85,000 or $90,000. That's not the operations of it; it's just sort of the physical cost and fixed costs on that. But I just think that there's, with all these wonderful portable, you know, the pilot or the pallet shelters and that kind of thing, if we could figure that out, that would just be fantastic. And again, I don't know if CARE Act funds could be used in some of that way, but I appreciate, Commissioner Farr, that you continue to share that, because I too think that that's really important for our unhoused community.
Chair, thank you, Noreen. And one thing I will say is that we need to keep the fans flamed on this, and we need to keep feet to the fire until it happens. I think it's relatively inexpensive, relatively easy. The units are available with a short lead time. And I think we just, once again, fan the flames, feet to the fire. When I say feet, I mean the Board of County Commissioners' feet. I'm one of them.
And as we mentioned fire, I'm interested in seeing, are we working with the chronically homeless for some of these winter units? Are some of the people here refugees from the holiday fires? How are we triaging and picking which communities these go in?
That's a good question. I can't speak to details just because I don't know them, but I believe that probably Catherine or Laura does, in particular on the referral process for hotel beds in particular. And I'm not entirely certain. I believe that the city also has a process for how rest stop beds will be allocated as well. So if Catherine or Reagan, you could speak to those items, that would be awesome. Because I do know that this has been taken into consideration with the hotel rooms. I do know that health is also a major factor of who we're hoping will be referred to those limited number of rooms that we have. Do either of you have any additional information, Catherine or Reagan?
I can start. Sorry, Catherine. I kind of wanted to speak to as well the conversation about the mobile showers. So I learned recently that the city through the EOC did order a shower trailer. I don't know exactly when it's going to be delivered, and we're going to need to figure out the operations. My guess is that we're going to start with the sanctioned sites, the rest stops, and some of the sites we have set up that we know where people will be and don't have access to easy access to showers to work on that. And then we'll have to figure out from there how we might expand those services. So that is coming soon. And the related to the shelters and how folks will be coming in, I think that as well will be an ongoing conversation. Right now, we know that there's waiting lists for the rest stop program and the community supported shelters and other programs that we're going to be working through to get people placed who are already sort of in the queue for that. But I think that there's interest in having those ongoing conversations about how we continue to have those programs integrate with our larger homeless services system and what that may look like in terms of referrals and intakes and all of that. Yeah.
Thank you.
And I can just quickly add that for the spaces that we're using the Emergency Solutions Grant funding for, we do have to do a coordinated referral process. And in that process, we, as Sarai mentioned, have really prioritized folks who are in need of non-congregate shelter from a health and a COVID vulnerability perspective. So we worked with public health to put together a list of health conditions and kind of prioritizing within that. So we have a methodology I'm happy to share with anybody who's interested that kind of lays out how that prioritization works.
Thank you. And on the showers at the county level, Commissioner Farr just said, by way of a little bit of an update, we have tossed that around with HSD as a possibility for the coronavirus relief funds. I think that at the time, what has happened is we've had to prioritize differently, partly because we haven't been able to stand up as many non-congregate shelter units as we were hoping to. But the county has been supporting an effort that is funded in part by Pacific Source Foundation in partnership with Carry It Forward to run a shower trailer in Springfield, which has been logistically challenging, but I think, and Chris, sorry to awkwardly ask you to put on your Carry It Forward hat for 1 second, but I'm not sure the status of that right now or how that's going or whether it's up and running, but that is, the county has agreed to rent that trailer through the EOC. And that is sort of where the county is on supporting this effort at the moment.
Certainly, Sarai, I can put on another hat briefly. We do have a trailer set up at 6th and C in Springfield. It is a shower trailer with, I believe, 4 to 6 stalls. We're in our second week. It's not a project that's directly underneath my supervision, so I do know that we are offering a minimum of 5 hours a week, upwards to 10. We also tied in on meal days where folks were already coming to the site for services as to be able to help coordinate and possibly provide a venue for outreach workers from the county and community partners to engage while people are waiting. We have it cleaned after every shower. We have a queue, social distancing, and access to basic resources such as the Whitebird Little Help Book, so that people can help navigate. So it's been really an interesting journey, but the city of Springfield really helped make it happen. They worked with the permitting and setting up the connections into sewer lines, and yeah, so it was. And I also want to point out that Aaron Fifield says that there's a combination shower restroom trailer located at Catholic Community Services in Springfield for the homeless families at G Street Oasis. So there's a couple options happening in Springfield that I know that the groups involved would be probably happy to share with Eugene and further Lane County partners. Removal of the Carry It Forward hat. And here. Thank you, Sarai and Catherine. and Laura for your work on this. Is there any questions to these staff members about the winter stuff before we move on to the next steps or the other updates? Seeing none, staff, it's your court.
All right. The next piece of this is really a matter of systems updates and identifying where we're at with our longer term goals toward adapting our systems and adding permanent supportive housing units and shelter beds to our inventory locally. So I am happy to tell you that some of these things have been moving forward, even though we're in the middle of a pandemic and the wildfires and everything else that has disrupted kind of our best laid plans. That said, I think we are making pretty good progress on those things while we integrate a lot of our strategies for this into the winter strategies as well. Looking at how can we leverage one-time funding that we have just for now because we really, really need it to help us also, one, mitigate the emergency, and two, make progress toward our longer term goals. So that is starting to happen. If you haven't seen this graphic for a while, it does come from the shelter feasibility study that was conducted a couple of years ago and adopted by the county and city of Eugene. And this is what is informing our systems transformation work as we continue to move forward. And that has to date been affectionately called the TAC report, but I'm pretty committed to not uttering the word TAC report too much anymore, so we can talk about it really as a system-wide thing. So we are working on all of these pieces. A couple in particular that are making some good progress right now is street outreach. And so right now we have staffed up both at the county and the city of Eugene to better coordinate outreach and to make sure that we have better geographic coverage. The county recently issued an RFP, and that was responded to conduct outreach in East Lane, and that includes Springfield. We're looking to also expand that out across the county geographically in the very near future, likely with some of the ESG funds that we expect to have in the spring. We also have case conferencing beginning. Case conferencing is where different street outreach workers from various organizations that do this kind of work can work together on challenging cases specifically and work to support individuals in a way that really will help them remove barriers to housing. Ultimately, street outreach is very much about building relationships and connecting people to services and resources that they need, and ultimately to help people prepare to move into housing and or even better shelter over the long term. So those things are all happening, and then we're beginning to convene outreach workers for coordination. So James Ewell has been in his position as the outreach coordinator, outreach and access coordinator for just a couple of months, and we're starting to see some great things happen there. We also have a couple of people doing street outreach at the county, and then have also recently seen a new hire at the city of Eugene to expand their outreach team to be more than just Brittany Rain. And so there are a couple of people there doing some work, and really internally between the city and the county, we're connecting a lot about street outreach, and in particular right now, tossing around a lot of questions about how do we interface in this moment with encampments and how does that all need to look right now. So that conversation is ongoing, but I am optimistic about it, and it seems like the city and the county both are really looking at this with new eyes and with some different resources that we didn't have before, in particular around outreach. And then the next one is rapid resolution, which is truly a diversion and rapid exit strategy. Rapid resolution is a way that we talk about having some problem solving conversations with people who are entering into shelter, perhaps for the first time, and or who might need additional supports to not enter at all. They might be able to access family resources or friends, things like that. So look into what are the basic needs that people have in order to help them not get into shelter in the first place, and also to resolve their homelessness situation as quickly as possible. And that work is also continuing. And I believe someone in HSD, please correct me if I'm incorrect, but I believe that there has been an RFP out for this already published, and I'm not sure when it closes or if it already has. Amanda.
Yes, that has already closed, and we have secured shelter care to implement that project. And so we're in the progress of sort of putting together that program plan, getting the training in place and all of that so that they're ready to go next year.
Yay, thank you very much. See, it's just as good as I thought. Hurrah. And then we also have an expansion of rapid rehousing. And this is another one that's a bit in Amanda's court, working on finding ways that we can do this better and to reach more people with it. So ultimately, people who are experiencing homelessness, one of the best ways that we can deploy resources is to help them get into housing as quickly as possible. And so that is also happening. Again, a lot of this will be likely funded with ESG, assuming that the state if that's not correct, to tell me that, Amanda. Accurate.
Yeah, so we do hope, and I'll talk in my next agenda item about how we do hope to expand rapid rehousing through our ESG funds. Although those are one-time funds, it's a good opportunity to sort of get this rolling. And we are also hoping in the beginning part of next year to hit the ground running, just like that picture right there that's on the screen. That will be me at the beginning of the year, hitting the ground running on rapid rehousing and starting to really make some shifts in how we're kind of rolling this out and making sure we have standards and training and really getting all of that work done that's in the TAC recommendations. So more to come on rapid rehousing.
Thank you, Amanda. And I really like this ponytail look for you. So I'm suggesting, never mind, your hair always looks fine. Okay, so then finally, we have a little bit of an update on shelter and navigation. So as you most likely have heard, the county has purchased a facility at River Avenue that once was a VA clinic and now is being used as a COVID alternative care site. We're very interested in pursuing that building as a possible location for the navigation center that we have planned. So the next steps on that is that we do have a city council presentation in January to discuss this facility and to identify any questions that council might have. And then we also are working with Pivot Architecture on this, and we'll be designing a process that can include people who may be using that facility or might have experienced it within existing shelters, to help us with that design for what the interior will look like, and then also to develop a timeline. And I'll tell you that my hope is that, assuming that City Council is amenable to this location as a place for the Shelter and Navigation Center, I would be hopeful that we could have our plans in place and be ready to issue permits and things like that by summer. We obviously don't have a timeline on when we won't need that facility for COVID-19 anymore, but I do know that we can make some progress on it in the nearer term and be prepared to get started on any retrofits or renovations that need to be done. One thing about that facility that's really promising and exciting, and if you haven't heard this, the county went ahead and purchased that building quickly because the timeline just needed to be that. And then because of that purchase and the timing and the use of it, we were able to retrieve funds from coronavirus relief funds at the state level to pay for the entire acquisition and the retrofitting that was done by the Army Corps of Engineers. So at this point, we do have a community asset that we've put about 5.2 or 3 million into. And that those funds have been entirely covered by coronavirus relief funds. So that's a really great thing and a wonderful resource that we have at our fingertips. So looking toward that. And then as far as the navigation part of this, just to kind of clarify, we've talked about this 75-bed emergency shelter as a public shelter, as a low barrier shelter, and also as a navigation center. And so the navigation part of this is the programming difference that we expect to help us to create flow within the sheltering system. The concept of navigation includes more intensive supports to help people remove barriers to housing, to identify places where they could potentially live, access the resources they might need, whether that's a voucher or a affordable apartment, things like that. that will help people kind of overlay their usual experience that they're in shelter, have a safe place to sleep, and can stabilize and move toward permanent housing as soon as possible. So with the winter navigation services that Catherine mentioned when we were doing our winter update, we're really looking at this as an opportunity to test and try out a navigation system that can connect people really system-wide to the different resources that we have available. And in order to also assess how many people really are out there needing units of housing and whether those folks might be better suited for PSH, permanent supportive housing, or co-housing, or single room occupancy, or other options that are available that we could be pursuing, I think we'll have a better set of data and more understanding about what people really want and need in order to become housed. So we're looking toward this winter as a good time to test this out, to be able to see what works, what doesn't work, you know, how to get more people involved, and ultimately overlay the system that we have in place with this effort to help people who are living unsheltered to access the resources and services that they might need in order to move into housing at some point. Here's a time for questions, feedback. If we have time, I will turn it back to you, Chair. Thank you.
Thank you. Looking around, I'm going to look for unmuted mics so I know who to call on. Pat?
Here, I have a question,
Oh.
if there's time.
Cheryl, go ahead, and then Pat.
Yeah, Sarai and Amanda, thank you for your work on this. I was just wondering if you could speak to the coordination efforts on things like the mobile outreach to make sure that we're not duplicating efforts. I'm thinking about, I'll just use the Eugene Mission. We've been operating mobile outreach since March, and I think it's so critical that, you know, the services are fully, you know, up to speed on what services are out there so that we aren't duplicating the same work.
I can speak to that if that's helpful, Sarai or Amanda. This is Laura Ashworth. I think you bring up a really good point, and definitely at the forefront of our mind has been wanting to make sure that we're leveraging existing services and not duplicating them. I think that part of the critical piece to achieving that is the outreach coordinator role that we have. And so, you know, when we go into contract, when we RFP these services, there will be an expectation in there that people participate in countywide outreach coordination, that they're working closely with the county, and that they're participating in case conferencing. And our hope is that, you know, as James kind of gets on the ground and is able to fill out in his role over the next month or so, that he'll be reaching out to all of the partners that are doing outreach and trying to convene. I think he's in process of planning a meeting now to try to convene people to talk about, okay, who are you? What are you doing? Where are you at? So that we can fit in and we can fill gaps. We're certainly not looking to stand on top of. We're looking to supplement where the areas are. And so I would say if anybody on this call has outreach services that they're doing right now, we are aware of the city of Eugene, but particularly in the Eugene metro area, but all of them really. If you could put it in the chat so that we could make sure that James connects with you, that would be really helpful.
Thank you, Laura. Did that answer your question, Cheryl?
It did, thank you.
Thank you. Commissioner Farr, did you want to speak?
No, I don't, Chris. I have a comment. My mic was not unmuted, but I just wanted to mention, Catherine, I just took a glance at the questionnaire that you put together regarding the outreach for participation in active shelters, and I think you've done a superb job on that. We're moving forward with identifying why people want to go to shelters and why they would avoid certain shelters, and this is really a part of the work that we're doing this winter as things get very well dynamic. You know, we're hearing that Lane County shelters, the Egan warming centers aren't filled, and finding out why they aren't filled. And you know, it's really interesting to find out some of the reasons that people aren't participating. So, Ryan, thanks Catherine and Ryan, thank you for setting that survey out so quickly.
Thank you. I see Sean Murphy and then Steve Manila.
Yes, I was just wondering with the street outreach, would there be an opportunity for an MOU to be created between county, city, and nonprofits so that lists and things could be shared? So if, you know, the city of Eugene outreach team finds a person that's part of the Fuse list, there'd be opportunities for them to coordinate so that they could access the services that they would be, that are already available.
I'll pass that one to Laura too, I think. Are you still here?
I am, but I actually had to step away from my phone for a brief moment. I apologize. Could you just repeat sort of the tail end of that?
I can address it if you don't mind, Laura. That's
yeah.
Okay.
Okay. Thank you.
Yeah, this really fits with what I wanted to comment on. I think Laura mentioned James, and I just wanted to remind the board that in this past year's budget process, we were given 2 additional positions. One is James' position for coordinated outreach and case conferencing. So the type of MOUs and arrangements that Sean is talking about and the coordination between the various organizations and outreach efforts, that's and the case conferencing, that is the vision of James' position, and that's what was recommended as part of our feasibility study. And then secondly, Catherine's position to help us in implementing both shelter and navigation and other the navigation center services and other types of sheltering opportunities that we have. So I think that you know what that shows is a commitment to, on an ongoing basis, to have a better coordinated and a more thoughtful approach.
Thank you, Steve. Any other thoughts or questions? A lot of content here, a lot of stuff going on. So thank you, Sarai, Catherine, and Laura. And can we please see the agenda again? So it looks like we have Amanda talking to us about the ESG CV application overview, and then we'll have public comment. I'd like to add anybody who would like to be in public comment, please either put your name in the chat or at the time asked. If no one else is speaking after Dan, I will open it up for last minute additions. Thank you, Amanda.
Thanks, Chris. So I have just a couple of slides just because it's a lot of numbers and a lot of information verbally. So this is just sort of to help us along. So I've already given a couple of updates on the Emergency Solutions Grant CARES Act funding that we're receiving. And this is sort of a more comprehensive update now that we have the competitive application that we are working on for that third amount. So I'll just give an update really quickly on the first couple. And you've already heard about a lot of the work through Catherine and Sarai about what we're doing around winter and shelter. And so some of this, I won't get into detail, but this sort of brings in the funding piece of how we're supporting some of this work. Let's see if this will work. There we go. So just to give a summary quickly, we've received a couple of direct allocations of funding, and those were the ESG CV 1 and 2 allocations, which equals about 2.1 million total. So I'll go through what we've used that funding for in just a moment. And then Lane County additionally will be applying to receive an additional 6.7 million of one-time funds through the CARES Act. And that's what I'll refer to as ESG CV 3, just to make it a little bit more clear. It's actually ESG CV 2 with the state, but it's confusing to consider 2 different ESG CV 2s. So that RFA, the request for applications, was put out a couple of weeks ago, and that's due December 27th. We will be submitting that prior to the Christmas holiday on December 23rd. So we are actually in the final stages. We have a final draft of that ready to go. And so sort of the purpose of this update is to give you an overview of what we will include in that application. So just to give a quick update on the first two, ESG CV1, if you remember, we received a direct allocation there of about 990,000. 150,000 of that went to street outreach. Some of the things that we were just talking about in those updates will support our East Blaine County rural street outreach efforts. So that will support a couple of FTE there, and that will be starting in calendar year 2021. The other remainder of that funding really primarily went to emergency shelter activities. So that's about 786,000. That amount will support our hotel motel emergency services and operations. That's the one that's operating through St. Vincent de Paul at University Inn. So we will be funding that for the beginning of the year, as well as the temporary emergency shelter beds that were set up through shelter care. And those are also for individuals at risk of COVID-19 complications. In addition, we are using some of that funding to fund our program services coordinator around emergency shelter and winter warming. And then we have a small portion that's set aside currently for family non-congregate shelter options, but that planning is still in progress. So that project is not yet operating, but we are working on that and have set aside the remainder of funds for that project. As far as the second direct allocation that we received, we have again put a significant portion towards street outreach, and that will go to fund the mobile housing navigation services that Catherine mentioned that will be supporting the City of Eugene microsites and rest stops, as well as our pallet shelters and other sites. And we're hoping to get that going in calendar year 2021. So that first RFP for the City of Eugene sites is out currently and will close in January. So that funding is coming from ESG CV2. The remainder of that funding, or most of the remainder of that funding, 586,000, is going into emergency shelter. We hope that that will support our efforts in continuing the hotel motel at University Inn for an extension through June of 2021, as well as will support the temporary emergency shelter units that Carry It Forward is operating, known as the Garden Spot. So those all will be supported with ESG CV2, the direct allocation. In addition, we've allocated a small portion for some additional staffing support to support our HMIS, or Homeless Management Information System. As you know, and as we've talked about, there are significant data requirements around ESG CV. So that requires a lot more system support as well on our end in order to support all of those additional users on our end, as well as the materials and supplies. So now getting into the competitive application. This is the third allocation that we haven't been directly allocated, but that we will be applying for right now. And that's about 6.7 million. So we've been undertaking a community investment planning process for the last couple of months since we had heard that this portion of the funding would be competitive. So what we really have tried to do is hold targeted stakeholder meetings, as well as bring in service providers and people with lived experience. So we've held meetings directly with providers on several occasions, as well as brought this to lead. And for the targeted stakeholder meetings, we held a family stakeholder meeting and a couple of different youth meetings. So we've really tried to pull in expertise on what we really want to invest in here, as well as we have been informed by our TAC recommendations, or our overall system goals that Sarai was talking about. We're really grounding the work in those recommendations. As we mentioned, this is one-time funding, but it's a really good opportunity to start moving some of these things forward and really testing out new models, as well as piloting some things. So we really wanted to ground it in what we want to do overall with our system, as well as balancing that with our more immediate needs that we're seeing right now on the ground due to COVID, such as non-congregate shelter. We've also really been trying to utilize our data, such as our homeless by name list, our HMIS data, our inventory, and really understanding where our needs are and what we really need to dedicate funding to. And I'll just mention, I'm speaking specifically about ESG currently, just because that's what the purpose of this is, but I will say that we are leveraging quite a few funding sources to really make all of this happen, ESG being one of the largest, but we are also really trying to lean on FEMA reimbursement for some of the operating costs, as well as CRF funding for acquisition of certain things. And then we also received some out of the cold additional state funding for winter sheltering. So we're pulling that in for specific things that are more winter warming, where ESG doesn't necessarily fit, as well as some others like CDBG CARES and some of the prevention rental assistance money that we've received. So this is really a full collaborative approach with multiple funding sources, and perhaps once we have allocated all of these, we can kind of put all of that in one big visual for you to see sort of what's being pulled in. But some of these decisions about allocations are still being made, so none of this is sort of final yet. So what we're including in this competitive application, we will have about 1.1 million that we are applying for street outreach. This amount will go towards continuing our existing or what we're starting up in terms of street outreach with the first two allocations. So that's the East Lane and rural street outreach efforts, as well as that mobile housing navigation services that I talked about. And then additionally, we're hoping to expand upon that within the metro area, adding several FTE to cover other areas. In addition, we are hoping to add specialized teams that can handle emergency health and mental health services out in the field. So this would be more of a health-focused street outreach team. This is one of the recommendations that really came out of the healthcare committee's work. And this will really be focused on access to basic healthcare, decreasing spread of COVID-19, as well as moving towards housing stability. So we're hoping to get that going into the new year. I don't know that we'll meet that January deadline, but this is in progress and we hope to have an RFP out for that soon.
Amanda, quick question on that previous slide, if I may.
Sure.
How are we identifying the metro area? Is that simply Eugene, Springfield? Is that counting the UGB, et cetera?
I believe that would include the UGB, but I wouldn't be the one to speak to that. Maybe Laura could.
So would you repeat the question? What were you asking goes in Eugene specifically, Chris?
The metro area, what is the actual jurisdictions and boundaries of that?
I think that's going to depend on the service. I think the street health and mental health team will have a broader jurisdiction. The outreach teams we have divided tentatively by the Eugene metro area, the East Springfield, which includes Springfield metro and the East rural areas. And then through the dislocated worker grant, we have a team of 2 that we're in process of hiring to serve what we're considering South Lane County, which is Crestwell, Cottage Grove, that area. And then a team of 2 that will serve West and North Lane County, which is Bonita, Mapleton, Florence, and Junction City. And then I think, with the ESG DV2, our hope is if we get the full allocation that we'll be able to add some outreach workers to the East Lane County, so it's the Springfield and rural area. And then the bulk of those will actually go into the Eugene metro area, in which case we'll probably start looking at smaller subdivisions of jurisdictions for teams to serve to make sure that we have full geographic coverage in line with and in collaboration with what others are doing. So making sure that we're filling gaps, we're not duplicating or stepping over.
Excellent, thank you. Thank you, Amanda.
All right, so in the emergency shelter care category, we are applying for an estimated about 2.1 million, and I put a little to be determined here because not all of that 2.1 is necessarily set aside for any specific project. There are a few, for example, we are continuing or hope to continue if we get this allocation, the temporary emergency shelter options that we have already started funding with ESG 1 and 2. So securing additional funds to extend those if we need to. as well as adding additional temporary emergency shelter, especially non-congregate. We do have our Brooklyn Avenue facility that was previously used for the Schenkel project that we hope to repurpose, and perhaps ESG can be used to support that facility. We also have a couple other things sort of waiting in the wings that are concepts right now that we could fund. So not all of that is allocated, but we do hope to put it into that category and apply for it so that we can receive those funds and allocate them. In addition, we hope to add some resources for youth and families. We've had a lot of discussions, like I mentioned, targeted stakeholder meetings. We have a lot of ideas floating around there around non-congregate shelter. So some of that planning is in progress, but those funds have not yet been allocated. But we do hope to set aside some within that total for those.
Thank you.
In addition, we do, sorry, did you have a question?
No, sorry.
Okay. In addition, we do hope to fund some homelessness prevention activities. Like we mentioned in previous presentations, we do have some funds right now that we are using, like the CARES Act funding, the CVRP, but a lot of that funding will end at the end of this calendar year, and we know that eviction moratoriums will start to be lifted into next year, and so we do anticipate that we may have some needs in homeless prevention, and we want to make sure that we can support folks in staying housed as well. So we do hope to add some targeted homeless prevention activities, especially for those who are impacted by COVID and continue to be through next year. We know that not all industries are going to rebound quickly. We know that folks will be at risk, and not all folks will end up kind of working with their landlords as closely on making sure they have a plan for repaying funds. So we know there's going to be a need, and we want to have some money set aside for that. We are limited in this competitive allocation to no more than, I think, 20%. So we are applying for close to that maximum, but we can't actually apply for more than that within this application. And then, like I mentioned, rapid rehousing is going to be a big emphasis with this competitive allocation. We're hoping to set aside about $2.1 million to support additional rapid rehousing slots for singles, families, and youth. At least 75 individuals for singles, 20 families, and 15 youth. And that does not account for turnover. So we hope to offer this, folks can receive assistance for up to 12 months, but with turnover and that sort of thing, we anticipate serving more households than what's listed here. And we hope to operate that for, I think, 15 to 18 months we will have if we get that rolling early next year. So just to kind of summarize all of what I was talking about there, this is kind of how it all lays out when you look at all three allocations. And like I mentioned, this is just ESG funding, but we are also, thinking about how we're going to leverage out of the cold funds, CDBG, et cetera. So we're really pulling in all of these and where they fit best with the projects that we're trying to get going. And there's certainly still room within this allocation, especially in that shelter category. We still have some funds that aren't dedicated to any particular project. So there's definitely still room for additional planning, additional concepts and ideas. So we're not done yet, but we will be submitting that application by next week for that $6.7 million, and we are hoping to get that full amount. So just to clarify, those awards will be made in February, so we won't know yet, but those funds can be spent back to March into 2022. So that will be sort of the time frame that we're working with these funds. We will have procurement ongoing. So like I said, we've only secured a couple of subrecipients for these funds, but as we sort of roll things out, we'll be putting out RFPs for these services. And we will have some emphasis on bringing in culturally specific organizations. If you remember, that's an emphasis that the state is putting on these funds. Culturally specific organizations are also encouraged to apply with the state. We have been doing a significant amount of outreach. Catherine and James on our staff have really been reaching out to organizations locally to pull them in. So that work is happening, and we do still have a lot to do there to sort of bring in that piece into our application. But that is part of the work as well. Are there questions about all of that?
Earlier, there was a deadline of December 27th. I don't know if it was this set of slides or the earlier one. Is there two different deadlines for different applications, or is it?
No. So the application to the state is due on the 27th, but because of the Christmas holiday and the 27th is actually on a weekend, we will be submitting by the 23rd.
Okay, thank you for that point of clarity.
Mhm.
Are there any questions for Amanda on this presentation?
Yeah, man, it's John Rich. I have a comment, probably more of a comment than a question, but I know you're dealing for people facing when the eviction moratorium ends and they'll owe all that back rent. I notice you have a funding stream in there under prevention, but is it enough, or are you pursuing other funding sources besides that?
I can answer that.
Okay, Steve.
The latest update on that is that the governor has proposed, in the special session that's coming up, $50 million to go directly to rental assistance to be allocated out to community action agencies like the other rental assistance was before, and then $150 million for a landlord program where landlords who have arrearages that go back or during the pandemic can apply for funding. And then in addition to that, there's $25 billion in the agreement that Congress is working on for rental assistance, and then a extension of the eviction moratorium federally through the next calendar year to the end of 2021. Also the governor's package coming up also extends the Oregon eviction moratorium that has some better features in it than the federal eviction moratorium. There's likely to be a lot of resource. What we know from what we have done with the previous rental assistance programs, that even with all this money, we're not able to help everybody who has a need in this regard. So this is just going to be ongoing work, and I'm sure that there'll be more discussion with the state and federal governments as we try to tackle this housing dilemma created by the pandemic.
Okay, thank you. I'm glad to hear there's options for people, so it's some potential.
Excellent. Thank you, Steve. Seeing the time, I would like to get started on the public comment. And if there's any further questions, we can have messages passed forward to Amanda, Steve, Laura, Sarai, or other staff on these types of topics. I would also like to acknowledge that starting next month or in February at the next all members meeting, we will have a carve out for a provider update. So that way providers who are doing services can share where they're at and what their barriers and or wins are. And also we're going to be doing some panel discussions over the next 6 months to kind of have better conversation so we can work together as a community. So with that in mind, I would like to acknowledge Dan Bryant as first. He has approximately 3 minutes, Bruce Abel, and then Heather Sleeky. And if anybody would like to tag on at the end, please send me a message. Thank you.
Thank you, Chris. First of all, I just want to say that this has been a great meeting. A lot of progress that's being made right now. That's all very encouraging. I just came from our microsite this morning on Roosevelt Boulevard, where we received 6 pallet shelters. Those were set up. Very excited to get that going. We'll have 6 Conestogas here before the end of the month at another site. This is all really great. Here's my concern that I wanted to speak to. As Amanda shared, this work is being funded through the ESG grants that are one-time funds. And I have a real concern what happens at the end of that year. Having done a lot of work, on these issues for the past 30 years and seeing how, for many years we depended on the mission as being the primary provider of shelter. And we concentrated on all the other tactics and left all our eggs in that basket and didn't increase our public shelter capacity. Now we are beginning to do that. My concern is the microsites and the rest stops that have been set up, I think, provide a wonderful opportunity for us to expand that capacity now. And so we just need to think about that, and particularly once the mission and Dusk to Dawn are able to return to more normal operations, if we lose the rest stops and the microsites, we'll go back to where we were. And so I'm just planting the seed now as we think about funding sources for 2022, that we really need to work on incorporating all of these new programs into that so that we don't lose what we've invested into these new sites. So thank you very much.
Thank you, Dan. Bruce?
Thank you, Chris. Hello, everyone. And I want to second what Dan said, that it's just really impressive, all the great work that is going on there, that all of you are doing. I wanted to speak. I'm part of really a non-existent group that calls ourselves The Way Home. And we're trying to be sort of the grassroots folks that are feeding and supporting people living on the streets. And Sarai and others who are doing the outreach, just to let you know that we've got a lot of contacts with people that are living on the streets and have built some pretty strong relationships with them. Part of our team is the Burrito Brigade, the Catholic Worker, the Heart of the Wit, which is a pantry that feeds and clothes about 200 people visit it every day. And we're supporting that. We're the group also that fed the 300 people on Thanksgiving with hot meals and distributed 200 cold meals. I just want to say, we have organized an event on National Homeless Memorial Day. That is next Monday for 12 o'clock at the 405 East 8th, the courthouse, just because we're really concerned about the sweeps that are continuing and the last sweep from under the bridge. And, just alerting folks that our goal would be to eliminate all sweeps, that they are so disruptive and damaging and traumatizing to the people who are forced to move. Many people lose their home, their possessions. And we talk about the trauma of being burned out by a fire, but the trauma of being evicted from your house, which is your tent, the only thing you own, and having that happen maybe several times a year to you is just so re-traumatizing. We're going to, by next year, we're going to be really trying to help the city make different policy decisions and help the county come up with better housing options. We would really like to see the fairgrounds, the university, some of the university property, other places opened up for legal camping through the rest of this winter and until the pandemic is over. So please, everyone, come to the event on Monday. And if anyone wants to reach out to me, Sarai, about community outreach, my email is probably available, and we would love to be supportive in finding ways to increase the well-being of people that are unhoused. And thank you for letting me speak.
Thank you, Bruce. Heather.
Hi. I'm Heather Slicky, and I wanted you to know that the Eugene Human Rights Commission Poverty and Homelessness Work Group will be standing in solidarity at noon in front of the courthouse to help raise awareness that Monday is the National Homeless Persons Memorial Day. It's the 30th year anniversary, and we've certainly seen a lot of deaths in our community that could have been prevented. The other thing that we're working on is better hate and bias reporting. We're trying to prevent discrimination against the unhoused and send a message to those in the community who see these folks as not belonging or criminal or unworthy. We're working with the City of Eugene Human Rights and Neighborhood Involvement Department to track and keep statistical information on both criminal and non-criminal hate and bias activity, and providing victim support and community response. And we're going to be tracking that both online hate and bias incidents and in person. We want the community to be informed that this is a serious issue. So thank you for the work that you're doing.
Thank you, Heather. I'd like to respond briefly to the comments and make a statement. We know that there are a lot of sweeps and we know that there's a lot of displacement. I would like to encourage people to remember that camping is not the solution. It is merely a part of the journey as we try and find better places and better support for people to where they will not be pushed along, pushed out because of the needs of their body, of their minds, or of their soul. There's a lot of trauma in this community and abroad, and we are trying to find ways to intervene in a meaningful manner. Part of that means increasing and supporting services such as inpatient drug treatment, mental health services that are not first come, first serve, but are actually delivered in the field, and helping support people getting access to meds that they know they need and have been asking for, but have no pathways forward. I appreciate the work of all of our subcommittees and our allied groups and our partners as we try and navigate these very tough times, especially in the winter. Anybody who has done a shift at Egan or has done outreach to the camps knows that these are trying times. And so we have to keep our morale up and keep our energy levels going so we can give strength to those who are losing it. So thank you for everybody who's participating in these meetings, who's following up on these surveys and questionnaires, and I really encourage you to stay involved. We have a long year heading across a plethora of crises. We're still going to be mending from the holiday fire. We're still going to be dealing with the after effects of COVID for who knows how long. So please, thank you. Please continue to be here, and thank you for being partners. If there's any partners that would like to, in the last minute, give a quick update, I'm open to hearing that. Otherwise, if there's any agenda items that you'd like to have considered in the next couple meetings, please forward them. Hearing none, I'd like to just say that we're looking at a couple panel discussions talking about shelter, accessibility to shelter, healthcare access, and victims of the street. How do we help engage? Those are some of the topics that we'd like to see in the next 6 months. And so if there is any items that you'd like to consider or participate in as a member of the board or as a community member, please let me know. Thank you again, and have a good holiday if you can, and please stay well and stay warm. Meeting adjourned. Goodbye.
Thank you, Chris.